Hello, welcome to Insights on Health. 50% of people do not visit the dentist regularly. What's keeping these people away? Fear, expense, time constraint? Today's modern dentistry is virtually pain-free and requires minimal visits because many procedures can be done the same day, and is also affordable because most offices offer dental financing. Today we have as our guests the dentists from Imagine Advanced Dental Arts in Lawrenceville, New Jersey. Dr. David Schor, Dr. Maria Rhode, and Dr. Vivian Messina. And welcome to all of you. 50% of the people don't make regular dental visits. That's amazing, an amazing statistic to hear. What can someone expect in 2008 from their initial visit to the dentist?
Thanks for having us, Mike. It's a pleasure to be here. In today's modern technology, most patients can access a practice's website, even prior to coming into the office. Patients then can acclimate themselves to the surroundings of the office. They can even read the biographies of the doctors, and they can also, in some instances, fill out the secure forms that are necessary when you would enter the practice. When they do enter the practice, they're usually greeted by a patient coordinator or receptionist who will then ask the patient to fill out these certain medical and dental forms. Right. These are very important because they provide us a lot of information prior to us examining the patient.
These kind of forms allow us to get an insight into a person's medical health, certain systemic disease that they might have, or that they may not even know that they have. Mm-hmm. For instance, there are many complications that you can see in a person's mouth that would be indicative of something going wrong in their body. Mm-hmm. If a patient had liver failure, we would see spontaneous bleeding in their mouth, perhaps from their gums or from their tissues. The liver is responsible for clotting factors in the body, which enables a person to stop bleeding. So if we were to look in someone's mouth and see that their gums were bleeding without touching them, that would be a precursor to possible liver failure. Mm-hmm. Another condition would be GERD, or gastroesophageal reflux, which is so prevalent in the United States. This is when gastric juices come up through the mouth and will dissolve the outer covering of the tooth, which is called enamel. When that happens, the white part of the tooth is stripped away, and then you start to see the yellower, more opaque, softer part of the tooth called the dentin. Once this erosion happens, it's really irreversible, and you need surgical dental procedures to repair it.
That's why it's so important for us to know the total background of the patient prior to doing any examination. Okay, if we don't have this history of their prior systemic problems, okay, we're going to see things in the mouth and we're going to be left at a lurch. We're not going to understand what's going on. And this is just, we have to take certain precautions when people have other systemic diseases when we're treating the patients.
We also do a periodontal screening on every patient to determine the health of the gum tissues and the bone, the supporting tissues of the teeth. Periodontal disease has been linked to several other systemic diseases of the body, such as heart disease, stroke, respiratory diseases, pregnancy complications.
Well, so in a way, it's a converse of what Dr. Rhode was saying, that not only can the mouth be an indicator of what might be going on, but it might be a partial cause of other situations, conditions in the body in general.
Yes, that's right, Mike. For instance, researchers have shown that people with periodontal disease are more likely to suffer from coronary artery disease. Bacteria from the mouth can travel into the bloodstream and travel to other organs of the body, such as the heart, the lungs, and the liver, thereby exacerbating other systemic diseases.
In addition to the periodontal screening, we're also doing a head and neck oral cancer screening as well. We're looking not only at their gums and at their bone and at their tissue within the mouth, but we're looking at the head and neck in its entirety, and we're palpating the lymph nodes which run down along the side of the neck and underneath the jaw. Right. And we're checking for any kind of nodular growth or swelling, which could be a precursor to early cancer change, God forbid. So to give you an overall feeling of that first dental exam, what we're doing is looking at an individual. We're not looking at him or her as a tooth-by-tooth problem, and we need to examine that person as an overall being, because they're coming to us for their dental care, which is affected by their systemic care, their medical care as well.
All right. Well, we have some calls lining up. Are you ready to take some questions?
Sure.
Let's do it. All right. We have Kevin on the line. Kevin, hi.
Hello, how are you? And thank you for taking my call.
Go ahead.
I have a quick question for the doctors. I've had allergies all my life, and my family doctor has run a multitude of tests on me. Unfortunately, we can't seem to figure out what's causing the allergies. And after another, I guess you could say, physical, the doctor recommended that I go see my family dentist because I have so many silver fillings. That could be causing my allergies. Does that make sense? And what can I do to fix this?
Kevin, hello, I'm Dr. Rhode. What amalgam is, which is the silver filling that you're referring to, is a combination 50% mercury metal, and the other 50% is tin, silver, and copper. And these are impure metals that, when the filling starts to break down around the tooth, the concern is that there's a leaching of these metals into the bloodstream or into the mucosa or the surrounding tissues. And because the nature of the metals is impure, some practitioners believe that you'll have an autoimmune type response, like an allergy or poor health or headaches or any combination of unusual symptoms.
Mm-hmm. Up until just several years ago, there really haven't been sufficient materials available to replace the amalgam. So it's always been, okay, you know, take out my mercury fillings, what are you going to put in there? Okay? You have to look at it from a holistic standpoint, of a health standpoint, of removing these mercury fillings, and also, but you also have to be a practical dentist, and how am I going to restore these teeth so that they can remain in the patient's mouth for the rest of their life and they're able to chew without pain. We have to look at each tooth and decide if the patient needs a crown, if it can be an onlay, or you can get away with just putting a small little white filling in there.
And could be a cost concern too.
Well, that's a big issue, because, you know, patients will come in and they'll say, I want all my amalgams removed, or take my silver fillings out. They don't realize that that's a big investment. It's an investment in time, and it's obviously an investment in money.
All right. Thanks for the call, Kevin. Let's shift gears here in another direction. There have been so many advances in science, and it seems like it's geometric progression in the last few years. And I'm sure the same is true of dentistry. For instance, I've heard that there is a laser device that can now detect early cavities.
Technology is just remarkable in this day and age. I mean, I've been in practice 30 years, and from the time I entered practice, and I would take a little instrument and I would stick it on the tooth, and if it was sticky, you had a cavity, and if it wasn't, you know, you didn't, okay? To where we do have an instrument now known as the diagnodent. The diagnodent is a laser which we can place on the outside of the tooth, the enamel of the tooth, and it has certain readings and certain markings that give us an indication that there is decalcification going on inside the tooth. In the, I call it the olden days, okay? In the olden days, and I was in the olden days, we would feel that little soft spot on the tooth, and then we would say to the patient, you have a cavity. We would go in and remove the decay, and you get through the enamel, and I can't tell you how many times I would say to the patient, I can't believe it's as deep as it is. Well, that's because it's detected so late in its progression. The diagnodent is a laser. Again, it's a light beam that penetrates the enamel. If there's the slightest bit of decalcification, which is the beginning of a cavity, it picks that up. And we can go in there now with all our new modern materials and just remove that little spot of decay, very non-invasive, and restore that tooth without having to get all the way in near the nerves and causing other, you know, root canals and whatever, that prior to this, these problems existed. You know.
What about some of the other new devices that you have at your disposal?
We also have digital radiography now, which is a big advancement from conventional radiography. In conventional radiography, you have the tiny little x-rays that are placed